Alright, today I'm going to do a Ezpap, and so the first thing I'm going to do is check the patient's chart to see if they need a nebulizer treatment or if they were post-op or anything like that. I need to see if they, the reasons for the treatment and their medical history. So when I'm ready, I'll enter the room, knock on the door, introduce myself, and then I always check the ID band, and then I'll wash my hands and I'll apply the appropriate gloving if I need some gloves on or anything like that. And I'll listen to the patient's lungs and chart down the pre-vital signs before I do the treatment. So when I'm ready to do the treatment, then I will get everything ready. So here I have a disposable manometer, so I'll get that out. Then here's the Ezpap. And what I'll do is connect it to the oxygen tubing here. You have to connect it to an oxygen source with this kind of device. So you would hook it up to here. Then you would turn it up to 5 liters per minute. And then beforehand, I explained to the patient about what this treatment is for. So this treatment is just to help clear out the lungs. That's help them cough up any secretions that they may have in their lungs to help them breathe better. And so then I grab out the disposable pressure manometer here. And what you do is you take off the end-piece clip and you'll connect it to right here, like that, and instruct the patient not to cover the back part as it will obstruct the airflow through the man. So the first thing we'll do is we'll set up their manometer to see where we would like them to be at. And so when they do this, we'll have them do a 1-to-3 or 1-to-4 ratio of breath. So they'll take a nice deep breath in. Doesn't have to be a full deep one, but just enough to get them a good, that way they're able to exhale a nice, that way. So basically, we're gonna have them go ahead and take a nice deep breath in, then we'll have them exhale with the mouthpiece in. So when they have a mouthpiece, we'll place, before they do it, place a nose clip on their nose, and then we'll have the mouthpiece, and they'll have instruct them to put their tongue underneath the mouthpiece, and that they will, and just breathe like a nice deep breath and exhale. And so make sure that they don't occlude the opening or anything like that, because we need to be able to have that flow with the oxygen, especially connected to it. And when they're done doing a few times, then we will have them take a nice deep cough. And so then we will either have they tend to have them cough into, or if the doctor needs like a sputum sample, then we'll have that and we'll have them cough into that. That way we can take it to the lab to let the doctor see what is in their sample. And then when we're done, we also chart what the sample will look like. If it's the coloration of it, if it has a distinct odor to it, anything that would have to do with the amount with it. So when I am done with this and they're done with their treatments, I would shut off the Ezpap here, remove it from the oxygen source, remove the tubing, and then we would remove the manometer, as this is disposable. So you want to remove this so that way you can get a new one and make sure that it's working properly. So we'd dispose of that. Then we would cover the end piece here so we don't get too much airflow into there. And then we would just wash out the mouthpiece and let this air dry, especially if they used it. If there's any moisture in there, we want to air dry it, and then that way they can use it again. And with the Ezpap, you can also connect a nebulizer treatment to it. So at the end, you would have a T-piece to it, and you would have a little cup at the bottom of it to place the medication in for the patient, and then they can use this as their treatment that way. So when we are done with everything, then we'll do the post-vital signs, and then we'll also listen to the lungs to see how they are sounding after the treatment, if they're sounding better or worse. And so I would go and wash my hands, and with the patient with the Ezpap, we'll have them set up with their elbows on the table, and if they, or even not if on table, just as long as they're sitting up, that way their lungs aren't pinched, or like be able to get that nice deep breath in and to exhale. So they'll reposition them when they are done, and then I'll wash my hands, and I'll go and chart in the patient's chart if what they coughed up, if they coughed up anything, if they were able to, and then I would let the doctor know that they had a treatment done.